I want to extend a very, very warm welcome to the participants from all around the world to this very exciting AMEE webinar. And I know more people are joining, but I will just give a brief introduction. This webinar is titled Adult Education and Lifelong Learning, Global Perspectives and Focus on the Health and Care Workforce. And today we're going to learn about an exciting new WHO initiative, and leaders of this initiative are here to speak to us. And I always forget to introduce myself. I'm Shubha Ramani, and at least for another 2 or 3 months, I will be AMEE president, after which I'll be the immediate past president. And I'm an internist and an educator from Boston in the United States. So first, I would like to introduce Dr. David Achwarena, who is the Executive Director of the newly established or about to be established WHO Academy, a global learning facility designed to build capacities and provide lifelong learning to the world's health professionals, namely us. Prior to joining WHO, Dr. Achwarena served for many years at UNESCO, where he was engaged in capacity building, policy work, and knowledge production in vocational education, adult learning, and higher education. Most recently, he served as director of UNESCO's Institute for Lifelong Learning, where he spearheaded various capacity building, policy, and research initiatives in lifelong learning globally. He holds a doctorate in economics from the Paris Sorbonne University. And we are truly deeply honored to have him here today. Our next presenter is Dr. Professor Janusz Jančukovič. He's the head of the Center for Medical Education and Vice Dean for Education at the Medical University of Łódź in Poland. He's the chair of the WHO Academy Quality Committee and consultant in education for WHO Europe and the WHO Pan-European Leadership Academy Lead for Education. He's working with multiple educational organizations, including being advisor for the Association of Medical Schools in Europe, AMEE, and the AMEE. He's been an AMEE governing committee member for a very long time, steeped in the history of our own association. He is a member of the board of directors of the European Institute of Women's Health, external expert for multiple accreditation committees, and the associate editor of the Medical Teacher Journal. And I'm particularly pleased to tell you he's been a trusted colleague and friend for many years. And before, although Dr. Mazunot is not presenting today, she is one of the leaders of the new WHO Academy's work stream on quality assurance, assessment, and credentials. Prior to joining the WHO Academy, Dr. Mazunot researched education, training policy, practice, and pedagogy in the UK, France, and in her native Finland, and developed content and curricula for undergraduate, postgraduate education, and continuing professional development. Anna holds a doctorate in education from University College of London's Institute of Education. And just basic ground rules, this is a webinar, and you can all see the Q&A box. So as it's interactive, please keep typing your questions into the Q&A box. We will also be monitoring the chats. And the presentation is going to be in 3 parts, and there will be a time for questions and answers between each of the parts, as well as at the end. And with that, I will turn it over to Dr. David Achwarena. It's a real pleasure.
Thank you, Dr. Ramani, and thanks to AMEE for inviting me to this webinar. I would like also to extend warm regards to all the colleagues who are online. I hope you can see my screen now. Thank you. Just a few words to maybe complement what Dr. Ramani just indicated regarding the structure for this discussion this afternoon. I will first introduce a few points regarding the broad landscape on adult education and learning, and then we'll zoom really in issues related to health systems and training and learning for the health sector. And finally, we will have an overview of the WHO Academy, where it stands, what are the next steps, including the official opening later this year. But first, we decided to open this discussion with a few words about adult education in general. I mean, this is indeed to signal that the discussion on adult learning in the health sector also is part of a broader landscape and a broader dynamics on adult education and learning. And what we've seen in recent years, I mean, to a large extent, the discussion and the thinking on the adult education and adult education policies has been reconceptualized within the broader concept of lifelong learning, also stressing the fact that adult education should be and is also a continuous process of learning across different ages and different conditions of peoples during the lifetime. The importance of lifelong learning has been redefined in relation to the current challenges that humanity is facing, and in particular the 6 dimensions which are outlined in these slides. Climate change becoming really a major element, also a major perspective and threat also to sustainable development. The rapid and deep transformation of the world of work, and this is maybe even more, I would say, emphasized now with the rise, the emergence of artificial intelligence. Indeed, digital technologies are not only transforming the labor market and the world of work, but also our everyday life. Demographic changes, demographic changes are another important parameter that is changing to a large extent the thinking about education and learning, and in particular the aging process, which is now affecting most regions of the world. And then the concept of citizenship is also regaining, increasing importance and attention, in particular considering the very particular conditions that we are facing in our societies today, with the rise of fake news, but also with the threats that we are observing that are affecting, maybe threatening the future of democracy in our societies. And then finally, health and well-being, and this has been even more, I would say, emphasized during and as a result of the COVID-19 pandemic, also outlining the fragility to some extent of humanity and of our societies, but also outlining the unity, the uniqueness and the necessity to have a holistic approach through the one health approach. So each of those parameters call for specific responses also in the field of education and learning, in terms of providing basic digital skills. I mean, the concept of digital literacy is now becoming essential to really fully take part in modern societies. The need to increase awareness, but also engagement of people in relation and to mitigate the climate crisis. Reskilling and upskilling on the labor markets, again, becoming even more than ever needed due to the rapid transformation of the world of work, the aging process, which I mentioned, and the need also to find new ways of learning in an intergenerational perspective, where younger generations can also not only learn from the older generations, but also contribute to and help them to adapt to a changing environment. Global citizenship, in particular in relation to media and information literacy, and of course, health literacy, which is a very important element to actually ensure prevention. Prevention is of course a major dimension to achieve health for all. So those are I would say, those are some of the factors that reshape and reconceptualize the landscape for adult education within the broader concept of lifelong learning. This landscape was actually discussed among member states at the so-called Confintea 7, the International Conference on Adult Education. It's a conference that takes place every 12 years. It's one of the oldest UNESCO conference. I think the first was in 1949. And it's a moment to actually review and take action, not only action, but reflect on the trends and the changes that affect adult education, considering the broader changes in the environment. So Confintea 7 is the most recent conference of its type. It took place in 2022, and it adapted, like all the previous Confintea conferences, the so-called framework for action, which actually outlines some of the directions to strengthen and to develop adult education and learning, but within the broader concept of lifelong learning. So the so-called Marrakesh Framework for Action was designed specifically in connection with the 2030 Agenda for Sustainable Development. So this vision of adult training as also an element contributing to sustainable development was one of the foundations of this conference and of this framework for action, looking at adult education as really an instrument to leverage and to transform societies. A new social contract for education, that was the ambition of the Marrakesh Framework for Action, to really mobilize all the stakeholders, all communities, all institutions to promote a vision of adult education as an instrument for sustainable development, but also as a right for individual and a right towards the establishment also of a right to lifelong learning. So the framework for action includes 6 dimensions, 6 elements, each of them pointing to a particular area which was identified as essential to bring about change in the field of adult education. There were some important commitments that were made by countries at the conference, in particular regarding funding, a commitment to, first of all, recognize adult education and learning as a public good, an area that also requires increasing funding from public sources, and that within a broader framework of funding for the education sector as a whole. So there were a number of commitments that were reaffirmed during that conference regarding funding, but also regarding inclusion as a very important consideration to ensure that adult education really be for all, and also for all dimensions of lives and societies, including health. And the expansion of the framework to new learning domains was an important discussion in Marrakesh, which took place right after the COVID-19 pandemic, and which clearly established also adult education and learning as a major policy also to for prevention and to promote health and well-being. So again, I'd like to stress the fact that this was an important moment to create a new momentum for adult education and learning, but also to promote this idea of developing a culture of lifelong learning through policies, through legislations, through innovations, including the use of technology and including in the health sector. And this is what we're going to discuss in the next parts of our webinar. Thank you.
I think we would have a minute or two for any questions, but as at the moment, I don't see any questions yet on the Q&A. We can perhaps proceed immediately to Janusz's presentation and then take questions at the end also for David.
Okay, thank you. Welcome, everybody. First of all, Shubha, thank you so much for the introduction and for the last sentence in your introduction. It is really a privilege to call you a friend. I'm just looking at all greetings from our participants. I see hello from Sweden, Pakistan, Poland, Witam Polska, Canada, Brazil, Australia, Portugal, Georgia, Oman, Iraq, Lebanon. It's absolutely amazing. This is the power of AMEE, that in these difficult times we can be here together. And I'm absolutely sure, I really believe that your capital of knowledge and experience here is much more important than the 4 panelists. So please ask our questions, share your comments, contact us via email when only you feel we can be of any help. So I will now share the screen. Can you see it now? Yes, I think so. So we take certain things for granted. So we are talking about lifelong learning, while this is, and we believe that we understand, that we know what lifelong learning is. In fact, this is a little bit cloudy or woolly term, and there are many definitions, as we are today in the context of discussing WHO Academy. So let's look at the definition from UNESCO, that lifelong learning is rooted in integration of learning and living, and it applies to people of all ages, and I will be back to this, all life-wide context, and it is being delivered through a variety of modalities. If you are a researcher, if you plan any research on lifelong learning, there are many papers with really heated discussions about the correlations, about the joint parts between lifelong learning, continuous professional development, and so on and so on. This is an example of one of such publications. I would like to be back to the Marrakesh Framework for Action discussed by David, because when I was reading this for the first time, I was really impressed, because again, I never reflected of lifelong learning. And then I saw the title, The Transformational Power of Adult Learning and Education. The word power, the word empowerment is really important. And then in this document, we can read that adult learning education is a response to securing peace, strengthening democracy, eliminating all types of discrimination. These are really important words. These are the words that should be embedded in our memories, because we are responsible for providing people with lifelong learning opportunities. Now, when we talk about lifelong learning, and especially when we talk about, of course, when we talk in medical context, we mostly think about postgraduate education and CPD, when a little bit wider context is including undergraduate education, very often very separate from postgraduate and CPD. The real beginning of lifelong learning journey starts not when the primary education starts, but just the first day that we were born. And for example, I may say in my case, and I think in many majority, all people that we are here, if we can be here, this is just because of our parents or the other carers that started embedding in us the ability to be curious, to search for new knowledge. However, there is also the other edge of this spectrum, and this is leaving the profession. This is a very often forgotten, very important group of people that not only deserve lifelong learning opportunities, but very often they can very effectively contribute to society. So lifelong learning starts when we are born and continues after, not till, but after we retire. And we need to acknowledge that this is not only postgraduate and CPD education. The other change of the spectrum that I would like to address, particularly in our context, is that we started talking about education in general and lifelong learning in health historically from the medical education perspective. So the initial name of AMEE, now we use it only as a sort of nickname, but AMEE was Association for Medical Education in Europe, or the Journal of Medical Teacher. Then we started widening the scope towards health professions. Now we know the very significant difference between health professions and health workforce, because health workforce are all the health workers who do not hold university degrees. And then the next step, and this I think started being very clearly visible, and I will show you the document last year, when we, at least for WHO Europe, we are aiming at talking about health and care workforce. And by the care workforce, I do not mean only people who earn money as carers. I mean all people who care about the other people. I mean, historically, we know incredible examples from the history of global health about barefoot doctors. We know the beginnings of education of modern health systems in multiple African countries and Asian and South American and South American countries were based on the backbone, even not of nurses, but so-called accompagnateurs or assistants of health carers. All these people deserve the lifelong learning opportunities, but it will not work if we not provide lifelong learning opportunities in health to the society. And now there is a really interesting document from WHO, Toolkit for dealing with misinformation. There are a lot of WHO Europe documents, booklets that we are very happy to share with you. And when we were historically talking about the health literacy of the public, our understanding was at first we need to provide people with basic literacy, and then we can provide them with health literacy. Now we know it's not working, because at first, after basic literacy, we need to provide people with digital literacy, because then majority of lifelong learning opportunities are being provided via digital channels. And this is also one of the areas we are discussing, and we are very much aware when we discuss the development of WHO Academy. So I'm showing this again, because when we talk about digital skills in the context of lifelong learning are not only applicable to the society and patients, but also to all health and care workforce. Not all workers in the health and care sector are sufficiently digitally literate. So we need to address multiple disconnections in lifelong learning between the professions, between, let's call it, the allied professions like public health, IT, administration, care workforce, practically unexisting educational opportunities at the moment, phases of education, countries and regions, and what I was talking about, this connection between the healthcare workforce and health literacy of the public. Only together we'll build this strong construct of lifelong learning, and we are aiming at the trust, and I'm sure there are many people who deal with teaching professionalism. You know how very important is the trust of the public and societies. So my colleague from WHO Europe, Pascal Goro, and we published not so long time ago, a short paper in Medical Teacher suggesting that if we know that trust is necessary for health, it's not enough to have the scientific evidence. It's not enough to communicate it properly, but we need lifelong learning education for the public. And now I would like to show you how we deal with this in the European region. This is the last year document, Health and Care Workforce in Europe, Time to Act. And let me show you that this document starts from Action 1, align education with population needs and health service requirements. Then strengthen continuing professional development to equip the workforce with new knowledge and competencies. Again, the stress on digital tools and digital competence. This all needs to support attracting and retaining health workforce in rural and remote locations and creating the working conditions promoting health, well-being, and just healthy lifestyle. So protect the health and mental well-being of the health workforce, especially in the context of health and care workforce. Lifelong learning is very strongly related to developing reflective practice competence. I'm especially using this, I'm repeating lifelong learning competence, reflective practice competence, just to indicate that this is something we need to learn, we need to support the other people learning, and we also need to assess it. So there is no time to talk for a long time, of course, about reflective practice. We have just like a lot of, this is an example from Scotland, we have a lot of examples where postgraduate education is focused on, maybe not focus one, but one of the primary areas of postgraduate education, lifelong learning is developing the ability and competence of reflective practice. I would like just to show one of the reflections for my students. Being a leader in health means the ability to find a balance between life and work, but also the ability to improve your working progress through self-reflection. These are the reflections from my international students after our module on reflective practice and leadership. So this is another dimension, and this will be so much supported by WHO Academy of Lifelong Learning and CPD for health, is that it needs to be proactive. It needs to be really responsive to the needs of the populations and societies and patients. And that's why most often when I talk, I know perhaps if someone attended my workshop, you might see this slide, but I ask people how much the education that you develop and that you provide to your learners responds, for example, if you are from the European region, to our flagship initiatives. If you are from any other regions of WHO, how much you adjust your education to the needs of your regions, of your regional programs of work of WHO. So for this lifelong learning, we need to be very much focused, especially today during the perma crisis, during this very rapid change process. What are the new competencies that should be added to curricula, undergraduate, postgraduate, and to the lifelong learning opportunities? An example of such competence that we are developing very strongly now, and we are providing the courses to postgraduate students, to carers, to health workforce, is so-called this new set of competencies called risk communication, community engagement, and infodemic management. We call it RCCIM, and we are again happy to share with you even the ready programs for teaching for your students and for your learners. However, This is the beautiful picture. Welcome, Georgia. Again, I can see people from Georgia. So I love this picture so much that I share it, and I always tell about the great good practice examples from Georgia when students learn in remote locations with patients. So we always need to remember when we talk about lifelong learning, the patient is in the center, not only as the passive recipient of the learning opportunities, but as an active expert by experience in what are the learning needs of the patients and populations. So coming to an end, I have only a few slides left. So the first slide is, again, I think everyone knows this concept of learning organizations, developing together for this joint capital of knowledge and experience of all the employees. But I think we are today here to discuss a wider concept, a concept of learning societies. And I think I'm showing the SDGs because this is very much the focus of lifelong learning that we need. So if I can propose that we start talking not only about learning organizations, but learning societies, I think this is the proper direction. The last by one slide is the slide again from my student, another student who wrote, although I don't have opportunity to change everything with a magic wand, I have the opportunity to study how we can change it step by step, starting from myself. And the really nice quotation is from Dr. Tedros. I really like the statement because this statement shows us clearly how important is education. There cannot be health without peace. There cannot be peace without health. And there cannot be health without trust. And there cannot be trust without lifelong learning opportunities for all the health and care workforce and for all the health and for all the people around the world. And now, if there will be no questions, we'll ask David to tell us about the great initiative, which is really the first response on this of this scale to the needs I was talking about. Thank you for listening to me.
Thank you, Janusz. We do have 2 questions in the chats. I was wondering, I mean, up to you. I was just thinking there's a question from Alvaro about healthcare happening in teams. I was wondering if you might want to answer that, and we can take the first question on climate change at the very end. Can you see the question, Janusz, or would you like me to read it to you?
I'm just reading the question just to, well, of course, this is, I'm sorry, I couldn't cover everything. I had only a little bit of time and I was almost sure that I will omit something. Interprofessional education is the foundation of contemporary education. So we talk about healthcare in teams, it's about interprofessional education. And I'm sure that this is clear for us as the representatives of WHO Academy, but this is clear also for us in education. I'm a medical doctor, so I can absolutely say that I believe, because traditionally we have this hierarchical structure, doctors at the top, it's not working anymore. This is absolutely the constellation of all professions. And even if we say that that the backbone of healthcare are nurses, I would say the person who says it is still comes from the privileged country, because there are many countries when the majority of the healthcare is even not on the shoulders of nurses and doctors, but just of carers. So you're absolutely right about that it happens in teams. And for Academy, we are very much aware of this. So the WHO Academy is absolutely not an initiative focused on doctors by no means. And I'm very, I want to say thank you for indicating the last question, very difficult and very, very painful. I'm very happy to discuss it. I stopped smiling because I'm very much aware about what happens around the world, including all the wars and the climate change also. But this is just, let's be back to this.
Okay, so we'll come back to the remaining questions at the end. So if we pass back over to David for the last part of the presentation.
Thank you, Anna. Thanks, Janusz, for setting really the scene regarding the actually articulation between and the application of the concept of lifelong learning in the health sector, or what changes it requires in approach. I liked in particular the last statement from your student. I mean, about the transformative approach, and saying that the transformation should start with a change within oneself. I think that's a very, very important element. And if education can change the world, it can also, maybe a first step is it can change people's perception of the world, and the perception of how they engage with the world and how they engage with others. Well, the WHO Academy is a very innovative and important initiative of WHO, really, to actually try to precisely reinforce, facilitate, promote this culture of lifelong learning in the health sector in the broad sense. So covering the diversity of actors that Janusz, you mentioned in your presentation. So of course, not only medical professionals, but much broader, range of professionals and workers bringing and providing care to other people, as well as the professionals involved in the design, in implementation, evaluation of health policies. Just to maybe stress the fact that the WHO Academy is part of a more ambitious process and vision, but it's not only about human resources for the health sector, it's also about actually improving the performance, the work of WHO, making it more agile, more efficient, more effective, and more relevant to the needs of member states and to the needs of people. So it's really part of this broader transformation agenda of the Director General. One of the points being, of course, to consolidate, to improve, to intensify the efforts of the WHO to provide access to learning for the WHO, for the health and care workforce, in support of the SDGs, and in particular the health-related targets of the SDG framework, and to make also learning in the health sector as fully part of the broader policy debate on health at international, national, but also at local level. And just to stress that this local dimension is also very important, very significant. We mentioned the fact already that patients must be at the center of the whatever approach for promoting learning in health, but it's also true for more broadly from communities. So indeed, I think it's important to have this dual vision and perspective at the individual level, but also at the level of communities, and communities engagement is in that respect essential. So a few words about the really the strategy, the approach, and the roadmap for the WHO academy. First of all, in terms of the target learners, I mean, they are five, main targets for the work of the academy. The first one, and that's the top priority, is the health and care workers. I mean, globally, but with a particular focus on low and medium income countries. Decision makers are also a very important element. I mean, to bring about change, you need also to reach decision makers, and this is one of the things that we are starting already to do by working on the programs on leadership in health. National institutes in health, that's also very important for us to have this engagement for not only building individual capacities, but also institutional capacities, and in particular in countries where the training system for health is not yet strong enough to assist those countries and those institutions to strengthen their capacities to provide high quality training for health workers. The general public, and this relates to the comment that I made previously on prevention, and again it relates also to the importance of not only training but also health literacy for the general public. And finally, the WHO workforce itself. The academy will also becoming the academy for the people working in WHO. The vision, the mission, and the goal. So the vision is quite ambitious. Again, it relates to this vision for promoting lifelong learning, to make sure that all health and care workers have the competencies that they need to actually contribute to achieving health for all. The mission is not only about providing content and promoting educational materials and provision. It's also about building a lifelong learning ecosystem, and I'll come back to that concept. And finally, the goal is twofold. It's both in terms of quantity. I mean, the scale of the ambition is enormous, so there is really a need to expand access and provision, but also to improve content. So it's both about the quantity, but also the quality of learning. To do that, we have five strategic objectives. I mean, the first two are about the provision of learning content and content which is learner oriented. So that's, I would say, the core, and that this is the immediate priority for us at the moment. But we also have a goal that goes beyond provision, which is about developing this learning ecosystem at the international level that will gradually link the WHO Academy with a range and a network of partner institutions around the globe that are also involved in providing learning to health and care workers. So it's this network vision which is important also, and the goal being to bring about change, but also synergy within the overall capacity to provide learning to health workers. An important element of the work is also normative in its nature. It's about the development and dissemination of quality standards. As you know, WHO is a normative agency. It's a normative organization. It provides, it has a very important role in terms of developing and promoting and publishing norms and standards in the health sector. The academy, in its work for education and training, will do also the same in relation to developing quality standards for training, for developing content, but also for delivering and assessing courses. And this is precisely the work that Anna Masnod is leading with her team. The ambition being not only to develop quality standards for the academy, but also for the rest of the organization, for other deliveries provided by WHO, and eventually we expect that those norms and standards will be applied by partner institutions as well. And finally, promoting a culture of lifelong learning within WHO also is an important element, making or reinforcing the organization as a learning organization. So how do we actually, approach this mandate? How do we implement our work? We are working in close collaboration with WHO technical teams. The priority areas for course development are identified from the country, the WHO country offices. So it starts really at country level and is consolidated at a central level by the technical teams in the different domains. And based on that, we have a collaboration with the technical teams. They provide the content and the academy is responsible for developing the learning strategy and the courses that are provided mostly online. Again, because of the scale of the challenge and the size of the target population, the emphasis is being placed on online provision, and the academy has developed its own learning experience platform, which is the key instrument for delivering training for us, although we will also, and we have started already to also have a blended and face-to-face courses. So we have 50 courses in the making at the moment, and we're just starting a new cycle for developing additional courses in line with the global program of work of WHO, which is going to be endorsed at the end of the month at the World Health Assembly. It's important to stress that a distinctive feature of the approach of the academy is the competency-based approach. So the courses are being developed in reference to competency frameworks, and in particular in reference to the global competency framework for universal health coverage, as well as other competency frameworks that WHO is developing in specific areas, such as One Health, such as digital health. So this competency-based approach is really the principle that guides the overall development of the courses in terms of design, in terms also of the learning activities, in terms of the assessment as well. So it's really a very fundamental approach that the academy has taken by using this model for the development of its entire cycle of course development. This concept of global learning ecosystem that I mentioned already twice is also taking place gradually, and in particular we are now starting to reach out to WHO collaborating centers. As you know, it's a very large and broad network of institutions, most of the times within universities, that already collaborate with WHO in specific areas, including education and training, and we're going to develop gradually relationship and partnerships with them, as I would say, an extended arms of the WHO academy provision. To conclude, a few words about our capacities and the WHO Academy campus. You see on this picture, that's how it looks like. So we are located in Lyon, which is an important hub for the health sector in France, but we've also many international connections. with global actors being based in Lyon from the sector, including also our sister agency, the International Agency for Research on Cancer, which is also a WHO institution, which is based in Lyon as well. In fact, a few blocks away from the academy. So it's important to stress that it will not only host, the building will not only host our teams, but also a number of training facilities for face-to-face, but also for broadcasting courses online from Lyon, as well as for hosting a simulation center in the basement of a building that will allow us to reproduce, in particular, reproduce emergency context, to train teams and decision makers responsible for emergency preparedness and response. So those are a few, points regarding the academy. Just I would like to also add by saying that the official inauguration is now scheduled for mid-December. However, we have already, as I said, started working. Some courses are already being provided. We had already some sessions already in Lyon, some training sessions, and we will continue to amplify this growth movement until the inauguration in December, and of course beyond. As part of that, we will also further intensify the partnership with sister organizations, including AMEE, and I think that this joint seminar is an illustration of this partnership, and we are very glad and grateful for AMEE also for the engagement in all the work and reflection related to the academy and its programs.
So we have some time for questions, and please do add in any additional questions that you might still have for the speakers to the chat. But if we can start from the very first question that was posed on climate change. David, are you able also to see the questions?
I think the question was on higher education and how higher education can actually respond or integrate this dimension. I think there are different dimensions in relation to that question. One is about awareness. Climate change being really such a major threat for the future of the world and of our societies, it is really it is imperative that this aspect is actually mainstreamed in higher education curricula, so that all students are actually exposed to knowledge about climate change, what it is, what are the implications, and how can we mitigate and be prepared for the implications of this transformation. So I think that's the first element. The second element relates really to the curricula and the programs of higher education. Climate change, with all the impacts it has on the economy, will actually bring many changes in terms of the needs for training. Some occupations will disappear. There will be new occupations, for instance, in the energy sector, but also in agriculture. So actually adapting to climate change, but also anticipating the impact will requires already a lot of agility in the higher education sector to actually prepare for that, to anticipate that some programs may have to be, closed down, others will have to be established. So there is a very dynamic movement happening because of this transformation, which affects and will affect deeply higher education institutions. And the third dimension, which I see, is maybe more fundamental. There has been a lot of discussion already for a long time, but maybe more even in the context of sustainable development. A lot of discussions on the need for transdisciplinarity. In most countries, universities remain, I would say, very conservative, and it is very difficult to move across the boundaries of each, departments. Bringing, sociologists to work with medical doctors, or so those bridges across the departments are very important. But at the same time, we know already that to address the challenges of sustainable development, there is a need to actually mobilize all the expertise, the knowledge, the wisdom from the different areas of the academic structure, so that there is also there are different ways of thinking that will emerge. And I think we see with now the challenge for in relation to climate change, that this change is much needed, and well, we hope that it will actually accelerate also the movement towards more transdisciplinarity within the academic world.
Thank you, David. Janusz, is there something you would like to add?
Yes, I would like to add a little bit to what David said about the climate change. Of course, absolutely, we have very few examples of proper connecting sustainable development goals and One Health concept with all phases of education in health sector. However, for example, in Norway, there is a medical school, maybe there is someone from the school that could build all the curriculum, medical curriculum, around sustainable development goals. So this is doable, and you can achieve the success. So we need to become leaders in this. Also, as the associate editor of medical teacher, I would say that I would be very happy to see submissions about projects related to bringing problems related to climate change, but in fact sustainable development goals and One Health to education. Now, I would feel very, very unhappy if I wouldn't be back to the most difficult questions here. The questions from Abdul Rahman, the question from Kartika. I am absolutely painfully aware of the discrimination, injustice, and sorrow excluding so many people from access to education. But at the same time, I really believe that one of the main goals of WHO Academy is to be available for all. And this is what both Anna and David could talk for a long time, how much time we are and how much effort we are putting in discussing how to make it available for all. Also, there are a lot of resources, currently available resources, free resources from WHO generally, which are not really easy to access to people that don't know the structure of internet sites and so on and so on. And again, I'm sure that WHO Academy will be a sort of a hub, bringing all those educational opportunities together to make them more available. So just as I said, I know how privileged I am sitting in a warm, quiet home and have a roof above my head at the moment. At the same time, in my city, Łódź, we have 70,000 refugees from the war of Ukraine. It's 10% of people in my city. I hope they all feel safe with us, but we know how much they need education also, and the war is only 300 kilometers from us. As the WHO AMEE governing committee member, I think, Shubha, we need to discuss and to ensure that for our CPD committee, that we really effectively invite our colleagues from underrepresented, discriminated, excluded regions, because this is really important to have their voice, just like the voice that we could read in the questions. Thank you
Yeah.
for this.
Janusz, that was, I think you raised a really good point, because Alvaro, who is on the call, the webinar, asked exactly that question. He would love, he's part of the, he's chairing the AMEE CPD committee and really is very interested in getting involved. So I think once the academy gets established and then we see a clear roadmap for partnerships, that is the time. And I think we're just very honored that all of you, the WHO Academy leadership has, or rather has allowed us to engage and become partners. But this is really the first session, more to follow. I think we'll have more details for collaboration.
Can I also respond to two more questions? Because there are two new questions. One question even submitted twice, just to reinforce the importance, from Siddharth. And I'm, when talking about WHO Academy, of course, our goal is to provide education for everyone related to working in the health sector, but you need to understand what that we are just developing. So we cannot start from the educational offer for everyone, because if you try to do everything, then you will do nothing. So I think this will be one of the steps to widen the offer, but for this we need to build the capacity and to ensure that what we are doing now has the proper quality, which is within the ANA's area of responsibility. About assessing and evaluating lifelong learning, if you really want to talk about this, please contact me via email, and I'm happy to discuss it.
Dr. Ramani, maybe if you allow me, just maybe a last point from my side regarding really this principle of inclusion and open access. It's important to actually mention the fact that the access to the WHO Academy platform, when it will be launched later this year, will be open to all freely. So there will be no fee charged to access the learning content. This is one. Second, in relation to this importance also of building and training teams. There was one question on this, just to mention the fact that the academy will not only offer opportunities to individuals actually to engage, I would say, on this kind of lifelong learning pathway, but will also in specific countries develop really a focus on the institutions and on in particular areas of the public health system, where we will be actually aiming not at reinforcing individuals but teams and supporting and assisting teams to better perform together. We are already doing it. We have started work already in the field of emergency care in Tanzania with colleagues from the technical team in Geneva, where we are actually using a simulation-based training to actually train teams, responsible for emergency services in district hospitals. So we will try to really to move on both dimensions, providing opportunities to individuals, but also developing institutional capacities in member states, in particular the most vulnerable, with a focus on building teams in different segments of the health system.
From my side, from Amy's side, I'm going to let Janusz have the last word, but it's been an absolute honor and privilege to listen to all of you. And I think we're all fighting the same battles, if you like, in healthcare and health education of the care workforce. And this is really the beginning. This is pretty much, we're going to be hearing about the developments, the initiative of the WHO Academy, and how AMEE can partner with the Academy. And I think opportunities will come up where we can all get involved. But at the moment, we'll have to be patient for a few more months to learn more details. Janusz?
we need to be patient at the same time, especially together with Anna. We are working on initiatives, how to share all the updates from Academy with our AMEE colleagues. So just be ready, both for the paper in medical teacher, for special sessions. So this is just the beginning. And I think the best summary is just not from me, but from all our participants, all the thank yous that I can see. And to respond to people who ask for my email, if you could just email our AMEE of the organizers and they will share my email with you. So again, thank you so much, David. We know that you need to run to another meeting, but everyone is busy. So thank you, everybody, and see you soon, I hope.
Thank you, and thanks to all the participants.
Thank you.
Bye.
Bye.
Thank you.
And
Bye.
I'll do that. Bye.